care of it for over a year, and then you're worried that it may be in the liver or somewhere else, sometimes you have to do PET scans to see the enormity of the problem, because then it will change which treatment avenue you're going to go to. So, but we can prevent radiation poisoning and radiation toxicity by giving the patients treatment, natural homeopathic treatments before, during, and after the PET scan, because a PET scan is 600 times the radiation as a chest x-ray. Now, you probably don't know too much that biopsies in and of themselves are injurious, correct? Just a simple biopsy is injurious to the patient. So you've got to think about that. You should be preparing a patient before their biopsy, if they're even going to recommend biopsy. But you're going to see, we know how to tell which cancer it is before you don't need a biopsy now. You can do liquid biopsies now. But a biopsy creates seeding. They did a post-mortem evaluation of patients who had had biopsy procedure before, and they saw the line of seeding. It is real. Don't let any one doctor tell you about it. Just like when you have surgery, surgery unfortunately creates seeding. This is just a sampling of the natural things. This is not everything. Not everything is here that gets rid and helps get rid of cancer, causing apoptosis, which is your natural programmed cancer cell death. So these are, again, just a sampling. It's not everything. So you've heard of hyperthermia. Hyperthermia has been around for years and years and years. Not in this country, but in Europe. It is covered by their medical insurance plans, hyperthermia. Cancer cells specifically do not like heat, so they die. It is a very effective, non-toxic treatment that augments your immune system and kills the cancer. We particularly use a machine from France because of the research we've done to figure out what's best. So cancer cells don't like heat, and they do, and if you have to do chemotherapy and hyperthermia are synergistic. I don't know if you guys have heard of mistletoe. Yes, you've heard of mistletoe. So mistletoe is a wonderful natural plant substance that helps you handle chemo better, creates a better sense of well-being in the patient, helps the patient be in an overall better state. They have less complications and better quality of life. So it is something that we give to a lot of our patients for a lot of different reasons. I don't know if you've heard of salicinium. Salicinium's only been around for about 6 years, and it is a natural substance that also goes after anaerobic cells. Otto Warburg won the Nobel Prize that cancer cells thrive in a hypoxic environment. That's how they get cancer cells. They dial down the oxygen to the cell and you can create cancer. So salicinium is an agent we give intravenously for a short period of time, and then you continue on a liquid version. There are some supplements that you can't take, which are at the very end of the PowerPoint, that discuss the different things you shouldn't be doing. So it is a modification of chemo, meaning instead of doing chemo, you can do this to eradicate your cancer. Now, this is a technique I've been doing for 4 years as of August. It's called the SOT, and I will give you the Reader's Digest version. We've done over 1,000 procedures. And what it is, they take the circulating tumor cells, they reverse engineer a new messenger RNA of the circulating tumor cells in your body, and that new messenger RNA disrupts the DNA of the circulating tumor cell and cancer cell. It is given back as an IV, one IV. That one IV will last 4.5 to 5 months. It is a 24-hour, 7-day-a-week stealth killing effect. It is amazing. As I told you in the very beginning, cancer is a formidable opponent. You got to do everything today. It's not like you can kind of go, okay, well, let's wait and see and how my alkaline diet is doing. No, you got to throw everything with the kitchen sink in it. That is just the way it is. I'm sorry, you know, this is my experience. I've been practicing 31 years, 40,000 patients. You know, you learn a few things. There's a lot I still have to learn, but you learn a few things. After being in the trenches, I work 5 days a week, and you learn. You get a pulse of what's going on. Reading about something in a book does not tell you the life experience. Do you guys agree? Agree. So this is amazing. Now, you probably have heard of IPT. IPT is the treatment for, I got a little minute, anyway, using insulin as the Trojan horse to bring in chemo. It spares normal cells, targeting cancer cells. Here's all the different things. You guys can look at that later. They're all in my book. But these are all the different things I decide to treat a patient in my team. But prevention, all of you guys now know we can prevent cancer. So there's a blood test called Oncoblot. We talked about liquid biopsies. Oncoblot is a liquid biopsy. What it does is it measures the ENOX2 protein, which is in all cancer cells. I've been doing it for several years, and now as of September, they're coming out with an advanced version, so don't do it now until they come out with their new improved version. Then you'll hear from Dr. Shando. I think he's here this weekend, supposed to be. Anyway, cancer profile test, I've been using that's a long time. You can look it up. It's American Metabolic Laboratories. One of the key things he tests is oxygenation. And oxygenation is important in every disease process, not just cancer. But it's a $450 test that tells you your adrenals, your certain tumor markers, HCG, which is the hormone of pregnancy and malignancy. And then this is something I've been doing for 18 years, the bioimmune survey. You have acupuncture points in your fingers and toes that correspond to every organ in your body. This was first taught by Dr. Reinhold Voll, V-O-L-L. You can look him up, 1940, right? 80 years ago. And his points have been now computerized in a machine called the Biomeridian EDS 2000. So we can determine if you have an environment for cancer and if cancer is happening in year 1 of a 10-year process. Amazing. I've been doing it a long time. So what is the most important message? Prevention, prevention, prevention. That is the cure for cancer. The other thing is there's lots of treatment options out there. Explore them, look at them. I connect with the world. I don't just rely on my California practice. I go to meetings in Greece and Germany and everywhere around the world to see what other options. Sometimes I send my patients to other countries that they can do what they need to do for maybe getting rid of the tumor burden and saving my patient. So, but the information's out there. It's not on TV. It's not in a newspaper. It's not in a magazine because they're all supported by who? Pharmaceutical companies. So you've got to take responsibility for yourself, and the future of medicine is self-care management. So, here's my book. It came out this year. The book, it kind of describes every single thing that you need to do that you can start on your own just to get well. It's not just for cancer. It's to get healthy and well and learn how to take care of yourself. So thank you very much.
Will you be around? Will you be hanging around?
I'm in the back. I am signing books, and I'm out there for questions, too. Thank
Fantastic. Dr. Connealy, thank you so much. And ladies and gentlemen, we're going to break in just a few moments, but a couple of announcements I want to make before you go.